This is the award-winning Lee Pitts Live.
Brought to you by the North Law Firm. For car accidents and negligent security cases, call Joe at 239-337-1191. And by Lee Health.
Southwest Florida, welcome back to Lee Pitts Live. We're here at the Charlotte County Health Department, and the accommodations have just been outstanding. Big shout out to my good friend over there, Joe Pepe, the administrator here. We have an interesting show in store for you today. We get a chance to talk to Dr. David Kline. He's the medical director for Virginia B. Andis Volunteer Community Clinic. He'll be joined by the CEO of that clinic, Suzanne Roberts. Also, we get a chance to talk to Ann Munville. She's a nurse with the Florida Department of Health right here in Charlotte County. And Joe North, the famed attorney who's doing a yeoman's job throughout the country, and specifically in Southwest Florida, from the North Law Firm will be here. All that's happening. I got a full deck, and we'll be right back. Southwest Florida, we're so thrilled that you stayed with us, and I think you're going to be thrilled as well. Let's get right to it. We'll get a chance to talk to Dr. David Kline and Susan Roberts. Welcome to Lee Pitts Live.
Oh, welcome. We're so fortunate to be here. Thank you.
Well, we're so fortunate to have somebody here like you who have just done outstandingly in terms of healthcare in the area with the clinic there. Let's get to find out, Susan, what is Virginia B. Andis Volunteer Medical Clinic?
We are the only uninsured clinic and pharmacy in Charlotte County. We started our services in 1999, and we were originally St. Vincent de Paul Community Health Care. We started out as a volunteer pharmacy. We grew pretty quickly, and through the dream of Dr. Asperilla and Dr. David Kline, our co-founders, we were able to open up a free clinic in 2008.
You said uninsured. What does that mean to the layman?
It's uninsured, and that's with no insurance. That includes Medicare or Medicaid. And those that don't know it, in Charlotte County, there's probably about an average of 28,000 folks here that are uninsured.
Okay, so a person who is insured can still take advantage of your services?
They cannot.
Got to go somewhere else.
That's right, and we refer all those folks.
Very unique, isn't it?
Absolutely.
Okay.
We are part of the National Association of Free Insurable Clinics,
I got
and
you.
we're also a part of the Florida State Association of Free Insurable Clinics.
Okay.
So,
Dr. Kline, give us your mission and some of your program services.
The mission is to take care of the uninsured, people who deserve, and everyone deserves, health care. These might be people who cut your lawn, paint your house, fix your plumbing. They work hard, have no insurance, they can't afford it. What do? You're outside the healthcare system, you get sicker and sicker, and when you get really sick, you go to the emergency room. It's not good for the patient, not good for the hospitals, not good for our society. People walking around ill. They can't produce, they can't work. Doctors in this area have been very humanitarian all the years I've been here, 40 years now. We've always done mission work, all types of volunteer work. And we practiced in the past doing these things. We had the caravan for migrant care laborers. We had other forms of outreach in order to take care of people. We kind of put it all together in 2008. Now, yes, myself and Dr. Asperilla are the founders, but there are many other people pitching in, hundreds of people in the area saying, we can do this. And we knew from the start if we're going to do it, it has to be good. Can't just say, well, it's free, so it doesn't have to be that good. There's only one standard, the ultimate standard. And you can't just shut it after 2 years. We know if you're going to do this, you got to keep on doing it. It would be cruel to start it and stop it after 2 years.
Now, you got free services there. Most of the time when people hear the word free, they may think that the quality of what they get is going to seem like something you would get for free, but that's not the case.
far from the truth, Lee, far from the truth. We actually pride ourselves, all of our physicians and medical practitioners and on the pharmacy side as well, are all licensed up to date, the state of Florida. Every single piece of equipment is either grant funded or donor funded. I challenge anyone to come for a tour and walk through. It is top notch and meets every medical criteria as if you were going to go to your own private practitioner. It is a wonderful building right across the street from Fawcett Hospital, adjacent from Bayfront, next door to Community Eye Center. And has 7 patient rooms. We have a beautiful waiting room for patients. It's truly state-of-the-art with state-of-the-art medical equipment as well.
Sounds pretty unique to a free medical clinic. That's like, I've been doing this show for like 28 years, done maybe 20,000 interviews, and that kind of, I don't think I've come across that yet, but not to go down that road. Tell me some of your, a success story.
Sure. We had a woman that came to us just shy of about 3 weeks ago. She came to us with breast cancer, and that was her inevitable diagnosis. She came to us just for a screening mammogram, and through one of our community partners, Project Detect, which is out of Riverwood community here in Charlotte County, she was able to get a screening mammogram. She came to us thriving, thinking she was healthy. It came back as positive. So
Early detection matters.
Correct. So we went ahead and did a diagnostic and a biopsy. She's thinking, oh, there's going to be no problem. I'm going to skate through. There's a lump. We have an issue. So, of course, to her surprise, I can't believe it. I'm healthy. I do everything right. But because of the funds, and we got it early, we were able to get her into Moffitt Cancer Treatment Center. She had a full lumpectomy, and now her markers are clean. We're able to yet once again, Lee, save another life in Charlotte County, and we were able to do that with one of our community partners and their funding, Project Detect.
Excellent. What are some challenges you face, Dr. Kline?
Well, sometimes people come in with very complicated diseases, and some diseases are very hard to treat, no matter how much insurance you have. So that's a challenge right there. Sometimes follow-up's a problem, patient compliance, giving consistent care across the board. There are certain specialties we're a little thin, but we get it done. Everybody gets the care that they need. It may take a little finagling, but we get it done. You talk about successes. When we started out 10 years ago, we said, well, we're just going to treat sore throats and sprained ankles to start with. Patient number 1, the first patient that came in, the first night I was there, turned out to have Hodgkin's disease, and we got that treated through our partners. Still alive. This is somebody's mother, grandmother, aunt, and she's still alive.
What are your hours? Are you like 24-hour walk-in kind of concept?
No, not that much, Suzanne.
We're open from 9 a.m. to 8 p.m. Monday through Friday, and our pharmacy is open on Monday, Tuesday, Wednesday, and Friday from 8 a.m. to 2 p.m.
Sounds like a one-stop shop, too. You can go in there and get your medical prescription and get it right there at the pharmacy.
Right.
Yes.
Pending approval. And this is very, very important for all your viewers to know, and the donors also. We have a screening process that every single person that comes in is required to complete, and that is that you're uninsured. You have to prove that. You have to prove that either you're working or not working in regards to the income that you're bringing in. We request it from the IRS, and it's very, very important to know that because we want to make sure that our dollars go to the individuals that truly need it.
That's very good to hear. Dr. Kline, early on when you were talking about people who may come in with some more elaborate medical needs, immediately in my mind I said, okay, you have to have a real good partnership with people who you can refer them to and make that process smooth for your client. Tell us about some of your partners out there and about your partnership here with the Charlotte County Health Department.
Well, the health department helps us, the hospitals help us, the other doctors in town. They may not directly be involved with the clinic, but they'll give us 2 cases a month. We can get fairly complicated surgeries done. A lot of colonoscopies get done, vascular surgery, breast surgery, things like that. We can get it done. Most of the doctors around here are fairly gracious. They will contribute some time and give us a couple of cases a month. Some of the more esoteric diseases that we might see that we can't just treat in-house.
Back to you, Suzanne, final question. Is you say you're free, okay, but when a person comes in there, they get the original for free. Then when they have to go outside of your area to something more elaborate that needs to get taken care of, how is that expense covered?
Well, that's through sovereign immunity. So all of our physicians, Dr. Kline included, all of our physicians and medical partners and pharmacists are under the sovereign immunity. And that is through the federal government. And if they hold a medical license and they're free and clear, they fill out the application. It is authorized through the Department of Health here.
Amazing.
Dr. Pepe signs off on it, and that's how we're able to do the good work, because that is in addition, they replacing the malpractice that they would have to have in their private practice.
Excellent. Surprising to me as well. I thought I had gotten you with a zinger.
No zinger here.
Okay. Now, Virginia B. Andes, who is she?
Oh, Virginia was a lovely woman. We lost her several years ago. She was 95 years young. She really had a dream to be a doctor one day, but she was so talented that she ended up being one of the first women engineers in the 40s for IBM. So she did very, very well, and when she retired in her early 50s, she and her family moved to Southwest Florida. So as she aged, she really wanted to give back. So she moved to Southport Square, started volunteering at Fawcett Hospital and other places. And then around 2008, she met our board of directors and Dr. Kline and Dr. Asprilla. And they really had a conversation along with our board of directors at that time with her, wanting to fulfill her mission too. So she was able to put some money in the Charlotte Community Foundation for a building one day. Originally, we were in 5 trailers on Easy Street. We were there for several years. So we were able to do that, and we jump-started some operational funds from her. And then we were able to, with the money from her, we always say, Virginia gave us our building, the community will give us our future. We were able to move into the new building that Virginia purchased for us in December of 2012.
Outstanding. Continue the good work.
Absolutely.
I know I said that was the final question, but I added in an extra one. Keep up the good work. Dr. Kline, Susan, you guys are just outstanding, and your whole, what I've just learned here, just we're blessed to have that in the community. As the saying goes on this particular show, for those who say it can't be done, they're usually interrupted by those like Dr. Kline and Susan who are doing it. When we come back, we'll continue to talk healthcare. Hi, everybody. Thanks for watching Lee Pitts Live. Of course, I'm Lee Pitts, the host of Lee Pitts Live. We're here at the Holiday Inn Airport in Fort Myers, and I want you to continue to watch Lee Pitts Live on television, on YouTube, and of course, listen to us on radio. But to get all of your shows to come right to you, just click on that subscribe button right there, and Lee Pitts Live will come right to you, your time, your way. That's Lee Pitts Live.